Hi, everybody. It's Andy. It's 4 o'clock, that time we come together every day to get an update on this battle against COVID-19. Now, things look a little different today, but things in our lives are different, it seems, every week. I am at a part of the governor's mansion broadcasting to you with just me and a camera with our crew that helps typically put on these updates elsewhere. This is how we're going to do it each day until I'm done with this quarantine. Let me tell you, we're doing great. I feel great. My family feels great. We are trying to be really positive about this situation. My kids have generally taken it well, though they're still kids. And we've decided that we're going to try to make the most of the extra family time we have. I want to thank everybody who has sent their well wishes, not just for my health, but also the member of my security detail who tested positive. And he's got some mild symptoms, but he's doing fine. He is a very good person. We don't put any blame on this on him or anybody else. We're all just trying to do our best to get through this and to get through this together. And to get through this together, it means that we all have to make sure that we remember those top 10 rules to ensure that we can defeat COVID-19. Defeating the coronavirus in the beginning was something that we hoped that we would learn about as we went. Now, we know the steps that we can take and the most effective steps that we can take to stop the spread of this virus. They start with wearing masks. Today, I'm wearing John G. Carlisle Elementary School from Covington, Kentucky. I appreciate them trying to keep their kids safe, and it's a great mask. Folks, wear it. It's a requirement in Kentucky, just like almost every state surrounding us. The more you wear them, the less virus will spread, the more things will stay open, the more we can open capacity, the better chance our kids can be in school learning more often, and we'll save a lot of lives. And that should be enough in and of itself. You got to engage in social distancing. And it's not a mask or 6 feet. It's a mask and 6 feet. And being outside doesn't let you sit 2 feet from each other without wearing a mask. So please put it on, keep it on. I know we won't be perfect, but do your best. Have one with you. And if you're alone outside, that's fine. But somebody comes close, put the mask on. Try to protect them. Try to protect yourself and your family. That's something pretty important to me. There's a lot of other rules that are up there that you can see, but one of them is answering the call. Dr. Stack will talk a little later today about how we can't test our way out of COVID. Instead, we engage in social distancing, we wear masks, but then we also answer the call when we have been around somebody who has tested positive. That's when the contact tracers ask us to do what my family and I are doing right now, which is to quarantine, to stay away from other people so that if we were to develop the virus, that we will not infect anyone else. And we're trying to live that example right now, even being the first family. I've always believed that you don't put yourself above the families of Kentucky when you are governor. You do everything that you would ask them to do, and that's what we're doing. And thankfully, in this situation, the last person outside myself, my wife, and our 2 kids that we were around was that potential exposure. So this is an example where answering the call can stop the virus from spreading, at least if it would have spread through us. I'm doing it, and I'd ask each and every one of you all to do it too. Also want to make sure that we thank all the people out there who are doing it right. I know that member of my security detail was wearing a mask the entire time. He was around me, as was I. And so I appreciate that. This is just an example of why masking up can be so important. So I want to start at the top today to make sure we're celebrating the good news, those doing it right. So much of whether it's our media coverage or cable news or the rest focuses on what I think is a small minority of people that maybe they're tired, maybe it's denial, but aren't doing the things that would protect those around us. You know what? Why don't we instead lift up those that are doing it right, that set positive examples and try to encourage everybody else to do it too. So today we're going to start with WKCTC. I've been to this facility. These are folks learning incredible career skills for careers that you can raise a family on. And that's what this Beshear administration wants, for Kentuckians to be able to work one job. Because if you work a hard week, you ought to be able to raise your family on that one job. So this is Mask Up Monday, and featuring Paul Caldwell and his students in the welding program at the Skilled Craft Training Center. October's Manufacturing Month, and WKCTC is proud to be a part of the community colleges training Kentuckians for manufacturing jobs. Really appreciate our community colleges. They have been consistently trying to get out there online and in the community to set the right example. So thank you to the overall leadership. Thank you to each of the community college and technical colleges leadership. Thank you to the professors. And you know what? Thank you to all these students doing it right, protecting each other. Next one is Casey showing us that we can have a little bit of style in how we mask up, show off a little of our personality, but appreciate her, making sure she spreads that message online too. This last one is pretty neat. I'll let everybody look at that one for a second. You know, they're about to have a child, which is an incredibly special day that I've experienced twice. They're about to have and meet their baby girl. And I remember the birth of my daughter, Lila, and they've taken this moment to encourage the best of the behavior of everybody else out there. I mean, think about this for just a second. Somebody in what is a very special moment in their lives took the time to do this, to send a positive message out there, asking for the very best of all of us. I think that is pretty special. We'll move into our COVID update, and then we will hear from Dr. Stack and from the Lieutenant Governor, and then answer some questions. We may have technical issues today. Right now it's going great, but please bear with us. You know, we're all doing our best, and we've got the whole crew from Kenneth at home to James in a different part of this facility, and everybody else doing everything they can to make sure this works well. So today, again, our escalations continue. Today is the largest number of cases we've ever had on a Monday. Remember, Mondays are fewer cases than most of the rest of the week because of the lab schedules. So today we're reporting 643 new cases of COVID-19. After our audits, that brings our total number of cases to 80,930. If you look back at the last couple weeks, last week, Monday was 543, the week before 456, the week before 406. So you can see a steady increase. That means that we've got to do better because we have more contacts out there, whether it's our kids in schools or the activities we're doing. We just have to make sure we're following these practices, and we want to moderate. We want to spread out the amount of contacts we have in any given day and any given week. Our positivity rate for today is 4.37%. Again, we're happy that is under 5, but we need to continue to push that down. Now, there are certainly other states where it is lower. We'd like it to be lower, and when we have as many cases as we do, even a positivity rate of 4.37% can result in a lot of Kentuckians getting sick. As of today, 672 Kentuckians hospitalized for COVID-19, 180 in the ICU, and 93 currently on a ventilator. Please pray for them. These are folks, especially on the ventilator, but also in the ICU, that are very sick, and they need your help, and their families need your support. Today, we've also lost 3 additional Kentuckians. Let's support them too. Continue to light our houses up green until we don't have to anymore. That's how resilient we can be. The three include a 79-year-old man from Boyd County, a 67-year-old woman from Fayette County, and a 61-year-old man from Grayson County. 94 of our 643 cases today are kids 18 and under. And our new cases by county: Fayette County 119, Jefferson 93, Warren 29, Laurel 22, Callaway and Christian 17, Henderson 16, Davis and Madison 14, Knox 13, Boone 11, Muhlenberg 10, and the rest are all online. Kentucky Child Care Facilities. This is the one new update I think that we are going to do today, and we'll have the others in these categories tomorrow. 19 new facilities with at least one positive case. 12 additional staff have tested positive, and 14 additional kids. We wish them all a speedy and full recovery. With that, I think we are going to try to kick it over to Dr. Stack to tell us where he believes things are, to give us some additional advice, and to tell you a little bit about quarantining, why we're doing what we're doing, and why we need others to do it when they get the call as well. So, Steve?
These learning curves here. Situation update for the state of Kentucky today. As the governor has already expressed, our case levels remain high. I remain concerned that we are still in an escalating situation. This is concerning because our level is at about 200 cases per million per day, which is substantially elevated. And if we continue to escalate from here, we could get up to the levels where we start to see substantial increased hospitalizations and people particularly ill, and then obviously the consequences that follow that. This is within our ability to influence. We can wear our masks, socially distance, and also practice good hygiene with our hands and surfaces. Additionally, if you are sick, please stay home. If you have a fever, a cough, a runny nose, loss of smell or taste, please don't go out in public, don't go to work, don't go to school. That's important in a normal year. It's critical this year that we don't spread any kinds of infection that we can avoid spreading, so there's no confusion about whether it's the coronavirus or some other condition. I was going to say, forgive me, this is a different format, it's a learning curve. Let me show real quick if I can. James, do you have the Ballard High School infographic that I was going to project here? We talk a lot about people getting sick and hospitalized and potentially having consequences as bad as death. There's another possibility, though. We're finding that some people, maybe up to 10% or so, can have lingering symptoms that go on for weeks or months. Things like brain fog, difficulty concentrating, I guess is how I would translate that, shortness of breath, fatigue, persistent loss of smell or taste. Those are obviously problematic. But we also know in children that we can have this multi-system inflammatory syndrome, and that this can be particularly serious. And so I don't know if the image is projected, but we do have a slide for in COVID-19 news for Ballard High School students. And this was in the media for this student named Taylor Kreitz, whose story was shared by her mother, Janelle Barden. And she got sick. Taylor got sick in June. She was positive for her test for about 3.5 weeks, and she had relatively mild symptoms, as the report goes, with loss of taste and smell. But she was cleared to return to field hockey and other activities. And during her athletic activities, she was experiencing chest pains and difficulty breathing. And it was found that she was having heart difficulties related to her COVID syndrome. She developed a fever, got ill, was admitted to the intensive care unit. So obviously all these things are terrifying for a young person in high school and for their parents. when she was in the hospital, she was cleared and released, and then had to be called back because she developed what appears apparently to be a viral meningitis. And so this poor young woman has had a relatively protracted course. And these are the kinds of things that can happen. And this is not, of course, the typical nursing home patient or senior citizen or someone with chronic medical problems. This is a young, healthy, athletic person who started developing symptoms for the post-inflammatory problems that happen after COVID-19. So I would urge everybody, please, this is not the time to be dismissive about this disease or to be cavalier about it. It's the time to double on our efforts and really make sure we minimize how much disease is in the community and how much spreads. And to that point, I come to my last point for today. The governor's quarantined, as he's already explained. I want to go over this a little bit, why this is so important. So we don't have any cure for this disease yet, and we don't have a vaccine yet that will prevent you from getting it. Those things are hopefully going to come down the road. Certainly, we hope a vaccine will be something we can start offering people in the next few months ahead. But until then, what we have are prevention and public health interventions. Prevention involves the things we talked about: social distancing or physical distancing more than 6 feet, wearing a mask whenever you're around anyone who's not from within your household, and perhaps sometimes even within your household if one of your members of the family thinks they may have been exposed. Also, washing your hands often, covering your cough. And then I told you previously, don't leave your house if you have fever, cough, infectious symptoms. Stay home until you feel better, or seek medical care if you're particularly ill. And if you think you could have COVID-19, please get tested. That'll help you to understand and put your mind at ease that you know that that's what the problem is, and help others give you good advice for what you should do. But the governor's quarantined because he was exposed to someone who tested positive. This is done to take someone who was exposed to an infected patient and keep them from being around others until they are outside of the window where they themselves could develop the infection. This is important because we are doing this to break the chain of transmission. And those words have meaning in public health. We're going to break the chain of transmission, meaning if the governor, the first lady, or his children should become positive for COVID-19, and we all hope that won't be the case, but if they should, they have not been in contact with anyone since they found out about their exposure. So the chain of transmission will end with them, meaning they won't spread it to anyone else because they won't be in any proximity to other people for the period of time that they're in quarantine. This is very important. It's what we're asking others of you to do throughout the state. It's what I would do for myself if I were to be exposed. And I think we should be very grateful that the governor here is obviously doing what he believes to be best for his family and those around him, and doing, importantly, what's right for the state of Kentucky to prevent any risk of him spreading infection should he turn positive, but also to model the good behavior that we ask of everyone else. So I'm grateful for his partnership in this as we navigate this. I'll also introduce one last term, and that's isolation. And isolation is different from quarantine. Isolation is when we separate someone who we have shown to have infection from other people because we know that they could spread infection. So in this case, the individual who may have exposed the governor to COVID-19 is in isolation until he is cleared from the illness. The governor and his family are in quarantine in case they were to develop the illness so they don't spread it. So we do similar things for them, but the difference in the two terms is very important. So thanks for bearing with me as I and the rest of us all learn how to adapt to this new format. I'll be back, I think, tomorrow with some additional updates on other topics. But thank you very much. And I think I'm supposed to now tee up the Lieutenant Governor to address other topics. There we go.
Kentucky. First, I want to begin by commending you, Governor Beshear, for doing the right thing. We talk a lot in this administration about our where, which is wages, healthcare, education, retirement, and the last one is example. And so thank you so much. Thank you to the First Lady. Thank you to Will and Lila for being good examples for the rest of Kentucky. You guys answered the call. And you are doing what it takes to mitigate this virus, and we appreciate you being a great example for everyone across Kentucky. Your staff has been flexible, your family has been flexible, and you've been able to work 100% from home today, just like thousands of Kentuckians have had to get used to doing since March. And so I want to thank you for walking the walk, and I want to thank you for being a great example. On behalf of Team Kentucky, we wish you all well, and we also want to wish well the member of our detail who has contracted the virus. We're sending you hope for a speedy recovery. So I'm here today to give an update about the Team Kentucky Fund. Last week, I got to announce that we surpassed the $1 million mark for dollars that have been distributed across the state to help folks who have fallen on hard times during the COVID-19 pandemic. I'm happy to say that this fund continues to be a lifesaver for our friends, for our families, and for our neighbors. And it is only possible because of the generosity of Team Kentucky. And for all of you who have contributed to this fund, you have helped make someone's life a little bit easier. You've taken a little bit of stress off of our families as we try to trudge forward during this pandemic. So I'm going to give you a breakdown of these the contributions and what they've been used for. So far, we have been able to help provide funds for 1,308 households. And the average assistance to each household is about $780. Nearly 2/3 has gone to help Kentuckians with their mortgage or rent. You can see that takes up the vast majority of the pie there. That totals more than $675,000. Over $150,000 has been used by Kentuckians to buy food and groceries. Over $130,000 is being used to help pay electric bills. More than $43,000 is being used to pay water bills. And then finally, about $20,000 is being used for natural gas, sewage, propane, and waste. So I'm going to say again, if you have been financially impacted by COVID-19, please visit teamkyfund.ky.gov. We still have a need for applications, particularly in many rural areas of the state. We've partnered with Community Action of Kentucky to make sure there is an office in every county across Kentucky that can help with this application. And also, if you want to give and you want to help your fellow Kentuckians like so many others have done, you can visit donate.ky.gov and know that each gift is tax deductible and 100% of your donation will go directly to help your fellow Kentuckians in need. And so today I'm going to close out with a little reminder for everyone to take care of your mental health. Our world has been upended since March. What we know to be as normal and convenient and perhaps things that we've taken for granted have gone by the wayside, and we have to make sure that we are taking care of our physical health as well as our mental health. Just a couple days ago, on Saturday this weekend, that was recognized as World Mental Health Day. And so in addition to doing things like staying physically healthy, which are the things we have to do, like washing our hands, wearing our masks, staying socially distanced, I encourage you to regularly check in on your own mental health and the mental health of those that you care about, your friends and family members and coworkers. Find a hobby. Find a passion, do something that allows you to step away from the anxiety and the stresses of regular life, but certainly life during the pandemic. We've got to continue to be kind to each other and be kind to ourselves and to extend that kindness on to others. So with that, I will kick it back over to Governor Beshear and tell you that it's great to see you and hope that you are doing well.
Thank you, Jacqueline. so appreciate everything you bring to Team Kentucky. Just a couple things that I wanted to make sure we mentioned. First, to Taylor, our student from Ballard that was willing to be courageous and share her story to help others. Team Kentucky cares about you. You got 4.4 million people in the state rooting for you, and a whole bunch of others maybe that tune in every now and then to see these updates. We are all on your side and look forward to everything that you are going to do in the future. I'd like to think somebody at your age willing to set this type of example. There's your future, your potential is absolutely unlimited. Second, wanted to give a brief update. Heard from Virginia. She is doing well. I know she will have probably an update later in the week. We love having Rachel, who I can see on the screen, but both Rachel and I miss Virginia too, and want to see her back as soon as we can. And finally, did you all notice that behind Dr. Stack, there had to be like 8 diplomas? I'm not sure all those can be real. So when this is all over and I'm out of quarantine, we will go check that out. Today, the questions we had were sent in. We will try to do it in a way in the future where maybe they can be asked by reporters live. Also want to work on something maybe while we're in this situation where we can do a Q&A with Dr. Stack, where I might be able to read questions to him from Kentuckians who are still wondering or are curious about some different things. So as we're going to try to make lemonade out of lemons, we're going to be as positive as we can about this experience. And so we'll get through these questions, and then we will continue to work to provide a good experience, but mainly the information that you need, the transparency. Answered a question about the security detail. That individual is minor symptoms. He's a tank. He's going to be great. We know he'll make a full recovery, and we're checking on him every day. What are you doing this week to encourage local law enforcement of your mask mandate? Have you given specific suggestions to local officials? And if so, what are they? So I haven't had a conversation with what I would call law enforcement, sheriffs or police chiefs around the state. I have talked to the mayors and the county judges, and I asked them to work with their local health department for enforcement, but I also asked them to show leadership, which they've been doing. Our local leaders have been great on the front lines, fighting this in their communities. One of the reasons that Kentucky's story thus far is one of the best stories in the country are these leaders who care about their communities. But one of the things that I asked is that they're out and about too. And if people see us as leaders in a grocery store where people aren't wearing masks, we need to mention something to the manager. Other stores as well. You know, if we can show that type of reaction, but pushing people to do the right thing, we can resolve a lot of this. And we really need from our businesses a no shirt, no shoes, no mask, no service. And it seems that we've moved in some from a policy that some of our larger companies had that required it to one where they're not going to ask people. Well, here in Kentucky, you have to. That's the way that we ultimately beat this virus. But at the end of the day, we can't enforce our way into the practices we need to defeat COVID-19. Team Kentucky needs to come together to do that. It's got to be self-enforcement, personal responsibility. We talk about that term a lot, but right now, our personal responsibility and our actions may be the difference between life and death of somebody else or infecting our own family. So let's make sure we take that personal responsibility and engage in self-enforcement. Since businesses are lax in self-enforcement, will you implement tougher enforcement, including fines on individuals who break the mask mandate in order to increase compliance to keep Kentuckians safe? We have several groups that are out and working on enforcement. They include our ABC, which is bars and restaurants. There have been fines. There have been closure orders. Also our labor cabinet, making sure that those that are working The employees that are working in businesses where lots of people come through are in a safe environment, meaning they are wearing masks, all the other employees are wearing masks, and the customers are wearing masks. But again, we need others out there working to do this too. We need folks not to try to come up with reasons that they can be the exception, but want to be a part of the solution. When COVID is over, do you want to be able to look back and say you did everything you could to protect the people around you, to protect your customers, to do it right? Or do you just want to get through it and not think about whether we left lives on the table, whether there are people that would have been here otherwise? And every major economist talks about how we deal with this virus is going to be the main and major determinative factor on how long we have a recession or how quickly we bounce back. So let's do this right, Kentucky. I'm trying to do what I can do to model the behavior that I'm asking out of everybody else. So please, if you will too, then we'll get through it together. What do I expect will be the largest challenges of doing my job while forced to be in quarantine for the next, and this says 13 days. I'm committed to being here as long as Dr. Stack and DPH advise it, and I've asked them to treat me like anybody else out there. So I'm going to follow all the rules and all the guidelines. The largest challenges of doing my job may be the amount of time that I was in a seat today staring at a screen. I had one of the busiest Mondays I've had in the last couple of weeks. We had a lot of work to do, and I'm working. I'm not taking any additional time. I'm working. I'm just having to do it like many other families are having to do remotely, with sometimes my kids bouncing in and out or a vacuum cleaner going. It's going to be all right. You know, I like being in the office just like everybody else does, but I'm still going to do all the duties of being governor. And I got a great support team around me that are working to make sure that we can get it all done. I'm trying to view this as a positive experience. You know, time with my family, time to focus, time to ensure that we are not just dealing with COVID, but we are investing in our future. I'm going to make sure I make the most of these next probably several weeks. And I hope that we see good results in policy that come out of it. Have I reached out to other governors for advice on how to best work remotely, such as some of others in recent weeks forced to do so in Virginia, Illinois, and New Mexico? Well, earlier today, I was on a call with all the governors from our Midwest Consortium. This topic didn't come up, but we did talk through a lot of other strategies. One advantage we have is we prepared for this. We prepared for this at the beginning of COVID. We prepared for this when Brittany and I had a scare earlier about whether or not we thought we were symptomatic. We've been ready for this. We have worked through the procedures, and they have worked really well today. That's a workstation and having everything else set up the way we need to. I think it says that preparation, when you have time to do it, can always help, and you will always get a better result out of it. And so I hope as a state and as a country, when we come out of COVID-19, we make sure we are better prepared for anything like this or any other type of disaster or emergency that we're going to face. Now, we've got some plans here in the Commonwealth about how to do that. It may involve even a little restructuring, but ensuring that all the different parts of government are communicating ahead of time about how to be best prepared. What will be my testing regimen going forward, and when was my last negative test? I last tested negative Thursday. I'm going to get tested, I believe, tomorrow. But regardless of that test, I will still be in quarantine. I guess if it comes back positive, I'll be in isolation. I will then be tested on Friday as well, and then into next week. Sometimes this virus can take several days to register in a positive test. So we are going to make sure that we are careful. And again, the length of the quarantine is going to be whatever DPH asks everybody else to do. We're going to do it right. We're going to follow the example. And I have had some friends that have had to go through this. we're ready. And the whole family has taken a positive attitude about it. And finally, the last one, and I don't know if the person asking this question knows that I knew this man, but do I have any reaction on the death of renowned hand transplant surgeon Joseph Coots? I was blessed to have served on a board in Louisville with Dr. Coots, who is a world-renowned hand surgeon. Brought so much prestige to the Commonwealth of Kentucky. Treated me like an equal on that board when he had been doing charitable work and built this amazing practice and become one of the best in the world. And he's willing to work with a kid either in his late 20s or early 30s. He's a really kind man. And his amount of civic work, I think, rivals even his skill as a hand surgeon. His longtime partner, Dr. Kleinert, was the granddad of a friend of mine. I remember being able to go to that visitation. With COVID and with our current situation, I'm not going to be able to do that for this other friend, but a great person who left a heck of a legacy. If we could all be so lucky to live that full of a life. So I think we got through today on this first one with relatively few technical difficulties, but folks, this is what it takes. And again, not that much is being asked of my family, just that we're not around other people and we do things differently. And I am sure as heck willing to do that to protect those around me and everybody else in this Commonwealth. If we can all follow the guidelines, if we can all try to live out the example, none of us are perfect. I'm not either. But if we can strive to do the best that we can, then we will look back on this battle against COVID and know that we gave it our all. It's the test of our times. It's a test of our humanity. I know we can pass it because I feel the love of Team Kentucky each and every day, even through the difficulties. So we're going to make it. Now let's just make sure that we bring everybody else along with us. So thank you, and we'll see you tomorrow at 4. Mask up, Kentucky. Oh, and we're going to leave you with a little video. Day 1 it's day 2 of quarantine, just to let you know that my daughter is practicing math with one of her furry friends.
What is 1 plus 3? What's 1 plus 3? What is it? She's like, What is it, 2? What's 1 plus 3?
My name is Henry.
Winnie, what's 1 plus 3?
Amazon Transportation Services.
Winnie, what is 1 plus
She's like
3?
asking for help.
Yay!
Yay!